I share the screen. My name is Judy Dooley. Judith is on the screen, but I actually go by Judy. I'm a pharmacist by trade. I've been with PACE for the past 26 years. When I first started with PACE, I thought, well, give me 6 months. I love patient interaction. So when I took this job, I took it for personal reasons because I needed to have off on the weekends because of spending time with my husband. And when I started, I thought, how am I going to have any patient interaction working for PACE? I'm in an office, I'm on the telephone. How am I going to do this? But what I found out was I could affect more people's lives in one area because this program goes across the whole entire state. So I've had the opportunity of meeting a lot of people, of working with a lot of individuals that needed help. And it just kind of warms my heart that I'm able to do this. So I stuck it out, and here I am 26 years later, managing a program called the Clearinghouse. So I'm going to share my screen now. Make sure I share the right one. All right, are you able to see my screen?
Yes.
Okay. So the program is called the Clearinghouse. It was originally called the Pennsylvania Patient Assistance Program, but technically it is the Clearinghouse. It started in 1999. Tom Snedden came to me. He's the director of PACE, came to me and asked me if I would start a program in Pennsylvania for individuals who were not eligible for PACE, but were either uninsured or underinsured. And at that time, the manufacturers the manufacturers programs, they still are, out there, but there was a lot of brand name medications that came out in that time frame. So a lot of individuals could not afford those medications. There wasn't Medicare Part D. They weren't eligible for PACE due to income or age. So he wanted me to reach out to individuals. We started with a few counties and gradually worked across the state. And then we started at age 60. And then we started to get a lot of requests for people that were under the age of 60. So we gradually decreased our age to 18 and older. Go to the next slide here. So our goal in the Clearinghouse is to assist individuals who are 18 years of age and older with any type of social and life-based resources. We search a lot of local and state national programs to provide this assistance. And I'm going to actually take it back one step. So as I said, we were originally starting to help individuals who were with their medication needs. And throughout that period of time, we've had individuals who couldn't afford their medical expenses. Maybe they had a hospital bill. So we would work with those individuals to find the financial assistance programs through the hospitals or the doctor's offices and help them complete that. But in 2014, PACE started to work with the Department of Corrections. And as a result of that, I was like, well, we have these people that are 65 and older that we're providing assistance with through PACE. What happens to these individuals when they get out of prison? Do they have family? Are they just going out back to the street? What happens? So that resulted in us, through the Clearinghouse, assisting individuals who were incarcerated and now re-entering society. Well, that whole process in 2014 really took the Clearinghouse to the next level. So as a result of that, we started to assist people with more than just medication needs. Now we enroll people and help them enroll in Medicare. We've gone into the state correctional facilities to help people that are 65 and older enroll in Medicare, do all that kind of stuff. But now we assist everybody across the state, whether they've been incarcerated or they haven't been incarcerated, help them through the Medicare process, help them through Medicare Part D, help them find the right plan, help them find jobs, help them find transportation and housing and legal assistance, just a bunch of different things. So when I say we research local, state, and national programs to provide assistance, to offer assistance, that's what we do. And we do that for whoever calls. We have a lot of individuals that are not aware of the LIHEAP program or not aware of property tax rent rebate, and they are eligible. So we help them complete those applications to the best of our ability so that they have these resources. And we offer these, so we do this, we stay connected, and we're very consistent with our contacts. We don't just reach out to these individuals, or they don't just reach out to us and we help them one time and say, okay, well, here's all the assistance we can offer you today, and that's it. No, we put them in a database, we create files on a daily basis, we put them out on a certain date to contact them again. So we stay connected. We stay connected with them, and we also stay connected with the resources that we found. We have developed a database in our system that we're able to have, my reps are able to look up the different resources or add resources to a database that they have found, or we'll go back and recall a particular resource that we found in the past to make sure that they still provide the same services. We go through the food banks. Well before the food box program in Pennsylvania, we were finding different food connections for individuals, because during COVID, people really struggled, whether they were elderly or they were young, they really struggled with finding particular resources. And then we research. Every client is different. When I hire new staff, I always tell them, we have this database that's rich in resources. However, this isn't all that there is. I mean, I'm amazed every day at the amount of resources my staff finds that I never even knew about. I'm just amazed, completely amazed. And all the resources and all the people that come together in these different organizations to help individuals, like that they don't charge for their services, or somebody lives in Pittsburgh and we need help moving furniture. Well, we've come in contact with different agencies that are like, well, we have volunteers that are willing to help move that furniture. So they want to give back to the community. So we've come in contact with a lot of individuals. And like I said, we schedule follow-up with these individuals. We don't just say, okay, well, we're going to connect you with this manufacturer's assistance program, enroll you in LIHEAP, enroll you in property tax rent rebate, enroll you in the food box program. No, we're not going to do that. We're going to call you back. We're going to make sure that manufacturer approved your medications. We're going to make sure that property tax rent rebate claim went through, that you received your check. So we put different dates on our files to follow up with these individuals to ensure that they receive the services that we're assisting them in applying for. Some of the programs, the types of assistance, like I said, are food. Like we help people enroll in SNAP. Therefore, we help them enroll in Compass. We have a special agreement with the Department of Human Services that we can assist individuals in applying in Compass to get medical assistance, or apply for like SNAP, stuff like that. Again, the PACE program, through our other call centers, we actually help people enroll in the senior food box program through the Department of Agriculture. So we have that. But then we know about different senior farmers market nutrition programs, and they're throughout the state. They provide not just, the carbohydrates, but fresh vegetables and fresh meats. And there's a program out in Pittsburgh that really provides a lot of services, a lot of food services. We help people get enrolled in Meals on Wheels. Of course, we search food pantries and soup kitchens, because there's a number of individuals, especially through the incarceration, and people that are re-entering society after incarceration, they're trying to better themselves, but they don't have the means, because maybe they just started a job and they don't have enough money to provide food for themselves and their family. So they start with these food pantries, they start with these soup kitchens, and then we actually help people try to give back. So the medical and prescription, well, that goes without saying. We try to enroll individuals who may start with us at the age of 60, and now they're 65. PACENet just increased their income guidelines. So we help them enroll in PACE and PACENet. Or we have individuals that are enrolled in PACE and PACENet, and maybe we've been dealing with them for years, and now they have a claim that didn't get paid. They have a prescription that didn't get paid. So they'll contact the rep in my department, and we'll work with provider services with utilization review. There are different areas in the PACE program to try to help this individual get this claim paid. We also help them enroll in low-income subsidy. So if they're not eligible for PACE and PACENet, then we try to enroll them in the low-income subsidy program. If they're on PACE or PACENet, we can help them and tell them, hey, yes, you are enrolled in low-income subsidy, because PACE automatically sends a file to Medicare to enroll these individuals in this help program. Like I said, with medical assistance, we have an agreement with the Department of Human Services to go through Compass to enroll people in medical assistance. So we take it from there. And then we have this patient assistance program. So this is our in-house program, the PA patient assistance program. We had to differentiate the Clearinghouse from this. So the Clearinghouse is the overall program. And I'll go back a little bit with that. In the legislation, in the PACE legislation, the Clearinghouse is actually listed as part of that law. So we had to change the name to the Clearinghouse for that reason. That's why the name changed. But these Pennsylvania patient assistance programs that we have, they were as a result of different Pennsylvania Attorney General lawsuit settlements. So the Attorney General at the time, there was different settlements with different either manufacturers or mail order drug programs, and they were able to get these settlements. And the settlements were then given to us, and we were able to create programs. The first program that we had was called the MEDCO program, and that was back in 2004. And MEDCO, which is a generic mail order prescription plan, they wanted to process all the claims. So we then facilitated that process. We would complete the allergy sheet, all the information. We would get their prescriptions on file from their physicians, and we would submit that to MEDCO. I thought that this is going to be easy. How easy is it going to be to give 3,016 people $600 worth of free generic medications? It was the biggest misconception in my life, because it was actually the hardest thing to do. It's very difficult to give something away for free. So we only had a certain period of time to use that money. And as a result of that, we lost that money. We enrolled people 2 and 3 times that actually found Bennett, that actually used it. And we're like, hey, this is real. Can I have more? But we ended up giving back over $2 million, which was really sad to me, because I thought, well, we could have used that in so many different ways. So I approached Tom Snedden and I said, Tom, is there any way we can get this money in-house, that we could set up a program that the pharmacy can submit the claims to us? We can follow the guidelines of these settlements and do it that way, which is how it started. So we have some programs that mimic the PACE program in the copay, as well as in the medications that are covered. So we're able to offer immediate assistance for individuals. It is a limited amount of assistance, but nonetheless, it's out there for individuals that we come across that maybe they are eligible for the manufacturer's program, but they're not going to get approved for 4 to 6 weeks, but they need their medication today. So we use it in those instances, or in instances where individuals have a high out-of-pocket, have spent a lot of money on their medical costs, and so therefore don't really have enough money to pay for these high-cost meds. I have sliding scale clinics here because there's a lot of people that need eye services. They can't afford their glasses. They can't afford dental. So we have found a lot of clinics in the state, like down below, dental, vision, and hearing services, that will provide a sliding scale based upon somebody's income. So we'll assist individuals in completing the application and trying to get them an appointment with one of these physicians or clinics to be able to get their glasses or their dentures or dental work done. And a lot of cases, hearing services. We started working with the deaf and hard of hearing most recently through, I think it's the Department of Human Services that has the program. So we started working with them and have been helping individuals in that program with different services. Again, like I said, we also help individuals with Medicare to enroll in Medicare when they're eligible. We've had a lot of experience with this because people that were incarcerated were not enrolling in Medicare in a timely fashion, and then therefore incurring penalties when they were getting out. Now, some people don't have the money to pay for Medicare, so they don't have a choice but to incur those penalties. But other individuals are eligible or are able to enroll in Medicare and want to enroll so they don't incur the penalties when they do get out. So that was kind of our segue into getting people enrolled in Medicare, learning the application process, talking with Medicare, having webinars to be able to do this for those individuals. So now we can help with those services, for everybody, whether they're incarcerated or not. So really that Department of Corrections program really allowed us to expand our services and what we do. And like I said, we help people find housing. We have some people who just are not able to afford their apartment anymore or their home, and they need a place to stay. And maybe they need to live in a certain area. So we help with that. We get a lot of inquiries for individuals who are in need of nursing home placement. So we get these hard to place cases, whether because they were in jail and whatever the reason for incarceration was, or we have people that are on ventilators, or people that just don't have the means to pay for an assisted living or whatever. So we actually have a program. We actually have an individual in the department that actually contacts nursing homes throughout the state to determine, what their criteria are for acceptance into the nursing home. Like, what do they need to do in order to be able to be eligible, for that. So we actually assist with nursing home placement, whether they have mental health issues or whatever. There's a lot of individuals that are under the age of 60 that want to own a home. They're saving their money. They have a good down payment, but they don't really know how to handle that. So we have found different classes throughout the state for people to take on home ownership, to be able to allow them to purchase a home and to be successful and not go delinquent on their payments. And then, of course, there are a lot of homeless people throughout the state, and we have found homeless assistance programs for those individuals. Again, we tailor our resources to that person's needs. Another thing that I never thought would be out there would be furniture and clothing and home goods. But, we go to the Salvation Army a lot, to Goodwill. Catholic Charities has helped us out with different resources. We had an individual who inherited his mother's home. However, his mother had passed away, and she had a lien on the home. He couldn't pay the lien. So we went to Catholic Charities and we said, we're looking for some assistance for this individual for this particular reason. And Catholic Charities offered half of the money that he needed in order for him to be able to take ownership of the home. We also found free legal services for him. And then Catholic Charities then told us about different organizations that might provide the other half of the money that he needed. So, we work with different agencies. Now, it may not be successful in every instance, but at least we can, give it a shot to see if they're willing to help us. We'll make as many phone calls as we have to in order to get the problem solved. And I can't say that we're successful 100% of the time, but we try our very best, to get these resources to these individuals. And then we work through, Who's Your Brother, New Digs, Mission Central. These are individuals, or these are organizations that provide, clothing to people who are looking for a job, or maybe are homeless and are looking to, rent an apartment, and they do have an income, but they're not dressed properly, or they need, they just need clothing to live. Maybe they were in a fire and they contacted us because they needed, resources to rebuild their home. So we'll help them. We'll send them to these organizations, contact these organizations to get individuals, connected. And the Society of St. Vincent de Paul, they help with a lot of household resources as well as clothing. I just listed a bunch of resources here, just to show some examples, but this is not everything. And then, as I indicated before, energy and utilities. We help them enroll in LIHEAP. A lot of people don't know about the weatherization program, so we'll kind of refer them to the Area Agency on Aging regarding this weatherization programs. There are other weatherization programs out there that we can refer people to that are not eligible because of age. And then there's a lot of different energy suppliers that have assistance programs. Maybe somebody's back on their electric bill or back on their gas bill. Well, there's different organizations, or maybe maybe they use MetLife, or I don't know what the gas companies are, but a lot of the different gas companies, and they'll use them. We'll go through them. They might have some resources that we can contact to help this person get caught up with their energy assistance. Then there's budget plan options. So once we get them caught up, then we suggest that maybe they go on a budget plan. So these are just again, different things that we do. Like I indicated, we help with employment because we do deal with people that are 18 years of age and older. So Office of Vocational Rehabilitation, that's always a good place. We go to PA Career Link because they'll help anybody. I mean, that's a really good resource. Indeed.com will help them go through Indeed to look for a job. We'll go through different staffing agencies, depending upon where they are in the state, because the state, there's so many different resources at all ends of the state. There's a lot of resources that are statewide, but then there's a lot of resources that maybe go down to the zip code level, which is amazing to me. And then we have a lot of individuals who don't have transportation. They need to get to a doctor's appointment, but they don't drive anymore. They had to give up their license. Their children don't live in the area. They don't have children. They live by themselves. So then we help them enroll with the CAT system in Pennsylvania through bus passes or, to try to get them, share a ride, whatever. And then with the LIFT program also. And then there's the MATP program, the Medical Assistance Transportation Program, which we try to get people enrolled in that who are eligible. Sorry, I had to take a drink. And then there's a lot of individuals who have legal issues, like I indicated earlier with that individual who was trying to get his mother's house, but there was a lien. And then once the lien was lifted, then he needed a lawyer to get the documentation to get the deed to the house transferred to him. So we use a lot of different legal aid programs throughout the state. The PA Health Law Project, they're very helpful. I mean, they've helped us quite a few times. Either they've helped us or they've referred us to somebody that could help us in whatever part of the state that we are, that person was in. We use the pro bono programs. There's a lot of lawyers out there that are willing to offer their services for free. And then the law schools in Pennsylvania have clinics where they'll actually use those soon-to-be lawyers to provide free services so they can get, some understanding of what's going on. And that's a basic summation of what we do. Our services have expanded. We try to meet the needs of all of these individuals that contact us. Maybe we are successful, maybe we're not, but we actually make a very good concerted effort to make sure that this individual gets what they need. The last couple of slides are, basically this is the brochure, and I'll be more than happy to send some brochures to Glenda, however many you guys need. But it really goes through everything that I just talked about. Do I qualify? Well, you must be a Pennsylvania resident because the monies that come to support this program, I mean, we don't charge anything for what we do, but it is funded by the Department of Aging through the PACE program. So lottery monies are used. So we try to only help individuals that are within this state. They must be 18 years of age and older. I have to say there's been a few instances where we've helped people under the age of 18. We say 18 years of age and older because usually if they're under 18, they're eligible for medical assistance. There's no defined income limits. People ask this all the time. Well, what are the income limits? Well, it's all dependent upon the resource that we find to help you. So in some cases, a lot of programs will write off expenses that people have. So if it's a medical related, program that they need, maybe they have a lot of outstanding expenses and maybe their income is just a little bit high. Well, a lot of programs will write off their outstanding expenses or expenses that they've incurred through like a yearly period. And like I said, there's no fee for what we charge or for what we do. We don't charge anything. If there's applications that need to be mailed or whatever, we send a postage paid envelope with the application, or we complete the application online because there's a lot of times we're able to do that. If we complete the property tax rent rebate application, of course, that requires some documentation. So we'll complete the application, print it, send a letter attached to it indicating what needs to be sent in the envelope, which is addressed to property tax or to the Department of Revenue, so that can get mailed, and we'll mail that letter for that individual, or they can mail it for themselves. A lot of times people will send stuff back to us when really they can just drop it in the mailbox themselves. And again, this is our telephone number, 800-955-0989. We're open 8 a.m. to 5 p.m. And after hours, there is a voicemail system, and those voicemails are taken off the system every morning. We also have a fax number, and we also have this email. We like to complete the application for our program on, like, when somebody is talking to that individual, because then we can find out what the need is. Is the need like immediate? Do they need services today? Do they need services next week? Are they running out of medication? And you don't really get that from an application that somebody fills out themselves, because the reps that take the applications, they ask a lot of questions. They want to know, like, what exactly are you in need of? And then when they get to the rep that's going to help them, then that particular representative will go through a bunch of different things that they can offer these individuals. And then the backside of the brochure just explains what the clearinghouse is, which is what I went through, and what we connect you to, which I went through a lot of these also. And but our help does more. I love this line. Many people rely on the clearinghouse not only to help to obtain needed services, but also for understanding and advice. So our staff will stay on the phone with individuals to talk to them, because a lot of people are lonely. Some people just want to talk and share. They haven't talked to anybody in a week, and they really just want to talk about something or talk to somebody to be able to, express concerns, or maybe they're depressed and and thinking of committing suicide. We've had this happen a number of times, so we can refer that person to the right resources. That my rep will contact me or the supervisor and let us know what's going on, and we can reach out to try to get somebody like the area agencies on aging involved with this particular person. So that has happened on a number of occasions. So we like to stay in contact with them. And sometimes if they just want to talk, we just let them talk, because that's what they need. So I'm all about that. I'm all about helping people and helping them find what they need and helping them, navigate through life. I think, that was probably the calling that I had to become a pharmacist. I tell everybody I wanted to be a pharmacist since I was in second grade. My mom had a lot of health issues when I was young, and I always wondered, how did that aspirin know to help a fever at that time? I'm showing my age. How did that aspirin know to help a fever? Or how did that aspirin know that somebody had a pain? And how did that aspirin know to get to the pain? That's what enticed me to become a pharmacist. But, second grade to the time I actually became a pharmacist, I saw that there were so many people in need, people coming to the pharmacy, getting their medications. Oh, I only have 5 of those pills because that's all I can afford today. And it was a medication that they needed to sustain their life. I mean, they had extremely high blood pressure, or they were diabetic, but they didn't know about these resources and they weren't able to pay for them. So that made me want to help people. And I think the first act of kindness that I actually extended to someone through PACE, I remember her name, was not about their medication at all. It was about a tree that was going to get cut down in her front yard. And she did not want the township to cut this tree down because her great-grandfather planted it. So I helped her contact the township where she lived, and she talked to them, and they didn't cut that tree down. Instead, they just trimmed the top of it, and that made her happy, but it caused her grief. And she just was beside herself with regard to it. So I'm grateful. I'm grateful for the job that I have. I'm grateful to be a part of this program, and I'm grateful to have the staff that I have that are willing to extend themselves and go above and beyond to meet the needs of Pennsylvania residents that are truly in need. And like I promised, the last slide has my information on, but I'll forward the slide presentation to Glenda, and she can forward that out to everybody. That's my email address for work. That's my direct line. The contact, if you need an 800 number, is the 800-955-0989. I'll be more than happy to answer questions either about, the clearinghouse or about PACE. I mean, if you don't think of any questions today, or you do have questions today, that's fine. But if you have questions in the future, don't hesitate to reach out to me to ask those questions. And I'll be more than happy to help you through the process, whether it's a claim of a prescription medication that somebody can't get filled, or questions about Medicare Part D as it relates to PACE. I'm able to answer those questions too, because I don't just wear the hat of the clearinghouse. I also am in charge of a lot of other things within the PACE program. So that's really all that I have, unless anybody has any questions.